Hello and welcome to a brief presentation, Advanced Care Planning, Learning Opportunities for Primary Care Practitioners. My name is Deborah Jones, Outreach Associate for the End of Life Care Program. The program was created to foster person-centered care that honors individual preferences by promoting dignity in health care at all ages and stages of life, increasing knowledge of, advocacy for, and access to comprehensive care, and providing in-depth training in advanced care planning. Advanced care planning brings physicians and other practitioners into the conversation about the end of life. So over the next few minutes, I will introduce 2 new codes for advanced care planning under Medicare Part B and 2 opportunities, a webinar and self-study leading to a certificate in advanced care planning. Medicare agrees that patients' wishes for treatment and care at the end of life should be honored, and that those wishes should move with patients through all phases of that care. So to support patients and eligible practitioners, Medicare B now has active reimbursement codes which took effect January 1st. If you're eligible to bill under Medicare B, then you can use the 2 codes. What do patients and practitioners talk about? Well, basically, what kind of decisions need to be made for the eventual end of life? What kind of care and treatment does the patient prefer within the context of those decisions? How to use tools such as living wills and healthcare proxy designations to ensure patient preferences are honored. And then specific legal forms that stay with the patient's record to capture those preferences throughout all transitions in care. Who starts the conversation? Patients can initiate it, or practitioners can initiate when there has been a change in health status or transition in care, such as a hospitalization. But in either case, advanced care planning is voluntary at the patient's discretion. This is a personal talk among practitioners, patients, families, and surrogates, so group sessions and telemedicine are not eligible for reimbursement under these codes. And patients must be present to discuss their own wishes unless they lack the capacity to do so. In that case, their preferences can be represented by a surrogate. So how does Medicare support the incorporation of advanced care planning into the primary care practice workflow? Well, first of all, there are 2 codes. 99497 applies to the first 30 minutes of an advanced care planning discussion. 99498 applies to each additional 30 minutes, and it's used in conjunction with 99497. Now, to be reimbursable, the billing practitioner must, in the words of Medicare, manage, participate, and meaningfully contribute to the provision of these services. However, given the breadth of advanced care planning, other non-eligible practice members can also be present or even discuss appropriate matters without a PCP in attendance. When can the codes be used? Well, they can be used during regular management appointments, including the annual wellness visit, but no active clinical management should be taking place once the advanced care planning conversation has started. Patients can make a specific ACP appointment, or a practitioner can suggest one. And there's no limit on the number of times the matter can be discussed. In fact, advanced care planning should be revisited often as patients' needs, preferences, and health status change over time. And one note, codes cannot be used in certain critical care and intensive care situations. Now, given the complexity of advanced care planning, many organizations exist to help, and some are featured here. Medicare at cms.gov has details on the CPT codes and how they should be used. And then the next 2, the National Hospice and Palliative Care Organization and the American Academy of Hospice and Palliative Medicine, have sites that focus on both the patient and the practitioner. The End of Life Care program is offering the ACP certificate, which I will talk about in just a moment, and there's compassion and support at the end of life, an organization that deals with advanced care planning whether you're 18 years old or 88 years old. And a prime mover in that organization is Dr. Patricia Bamba. Dr. Bamba will present at a 1-hour webinar devoted to the CPT codes for advanced care planning and POLST, Physician's Orders for Life-Sustaining Treatment. That webinar is March 22nd, beginning at 11 a.m. Eastern Time. For registration, go to the End of Life Care Program website. Dr. Bamba is a renowned expert in palliative and end-of-life care. She's also a member of the National POLST Paradigm Task Force. She will be talking about the advanced care planning spectrum, and that means from health through change and eventual decline. How and when to use codes 99497 and 99498. Advanced directives, both in terms of the general principles and then the legal forms that go along with them, and she will do an overview of national POLST protocols. Now, each one of those topics is deserving of its own deep dive, so the End of Life Care program created a certificate in advanced care planning for primary care practitioners. The 4 1-hour online courses emphasize advanced care planning in the office setting, and they build from an introduction to quality of life aspects through to legal considerations, do the actual legal forms for capturing patient wishes, and finally, the conversation itself, which is a real-time remote simulation of an advanced care planning session. Sarah Lawrence is sponsoring continuing medical education, nurse continuing education, and MSW continuing education units through joint providership with the National Hospice and Palliative Care Organization. To deliver the curriculum, the certificate has brought in instructors with broad experience in health law, patient representation, and advocacy, and they include both practitioners and medical practice educators. The courses will be available online beginning in April, so for descriptions, fees, and registration information, visit the End of Life Care program website. And your key contact for more information on either the End of Life Care program or the certificate is Rebecca O. Johnson, Associate Program Director in Graduate and Professional Studies at Sarah Lawrence. And finally, when the Institute of Medicine released its report Dying in America in 2014, it said a person-centered, family-oriented approach that honors individual preferences and promotes quality of life through the end of life should be a national priority. So we hope that you will take advantage of these and other learning opportunities toward creating a comprehensive care culture that truly does promote quality of life from beginning to end. On behalf of the End of Life Care program at Sarah Lawrence, I'm Deborah Jones. Thank you for listening. This concludes the presentation.